Hello everyone, welcome to BioTales. Today we are going to talk about a very common disease of dogs, that is canine rabies. Rabies is a lethal virus that affects the brain and spinal cord, infecting all animals including dogs and humans. It's preventable and treated, but early discovery is essential. The virus is lethal once symptoms develop. The only method to detect rabies in animals is via death. Therefore, keeping pets vaccinated is critical. Rabies may be found around the world, including North America, Central and South America, Asia, Africa, the Middle East, and portions of Europe. However, several places are still rabies-free, including Antarctica, Australia, Fiji, Finland, Iceland, Ireland, Japan, New Zealand, Norway, Sweden, and the United Kingdom. Now let's see how a dog can get rabies. Rabies is a saliva-secreted illness that is most usually spread through infected animals' bite wounds. It can enter the circulation or open wounds that have been exposed to infected animal saliva. Rabies is most usually transmitted to dogs by exposure to wild animals such as bats, raccoons, and foxes. Domestic pets such as cats, dogs, and ferrets are also at risk for rabies infection. Rabies is not extremely prevalent in dogs in the United States and it is completely avoidable by immunization. The virus spread by bites, with foxes serving as the primary reservoir in Europe and skunks, foxes, raccoons, coyotes, and bats in North America. In Asia, Africa, and Latin America, stray dogs are the primary reservoirs, with human infection and mortality more prevalent. Let's see what is the incubation period of this disease. The incubation period, that is the time until clinical signs appear, can vary from 10 days to 1 year or longer. In dogs, the incubation period is typically 2 weeks to 4 months. The speed at which clinical signs develop depends upon several factors that are the site of infection. The nearer the bite is to the brain and spinal cord, the quicker the virus reaches the nervous system. The severity of the bite, and the third one is the amount of virus injected by the bite. Now we see that what are the symptoms of rabies. Rabies is a disease that progresses in stages following a bite from a rabid animal. The prodromal phase involves a marked change in temperament, with quiet dogs becoming agitated and active pets becoming nervous or shy. There are two recognized forms of clinical disease: furious rabies and dumb rabies. Furious rabies are those which occur when the rabid dog becomes aggressive, highly excitable, and displays evidence of depraved appetite, eating and chewing stones, earth, and rubbish, and paralysis eventually sets in. Hydrophobia is not a sign of rabies in dogs, but it is a feature of human rabies. Now you see what is dumb rabies. Dumb rabies is the more common form in dogs, causing progressive paralysis involving the limbs, distortion of face, and difficulty swallowing. Owner may think that the dog has something stuck in mouth or throat, but care should be taken in examination since rabies may be transmitted by saliva. Ultimately, the dog becomes comatose and dies. If your dog is bitten by another animal, pay close attention to their behavior and call your vet immediately if you suspect rabies. Physical signs of rabies include fever, difficulty swallowing, excessive drooling, staggering, seizures, and paralysis. As the virus progresses, your dog may act as though they are overstimulated, seeking out a dark, quiet place to hide or acting aggressively. Foaming at the mouth is one of the most well-known symptoms of rabies in dogs. In the final stages, seizures and increasing paralysis are common, making swallowing difficult. and eventually leading to death. Now we see that how rabies can be diagnosed. Rabies is a disease that cannot be diagnosed in living animals but can be detected through direct brain examination. If there is high suspicion or an animal shows symptoms of rabies, a vet may recommend brain samples for testing. Blood tests are not easily accurate as they require a biopsy of brain tissue, which can only be completed after the animal has died. Rabies symptoms in dogs cannot be treated, and if diagnosed, the dog may be cured. However, if a wild animal attacks the dog, a booster rabies vaccination may be administered to lower the chance of catching that virus. Now let's talk about rabies vaccination and prevention. Rabies vaccine is the most effective technique to prevent rabies in dogs as it protects the dog not only against rabies but also from bites. If your dog has not been vaccinated, they may be confined or even killed because to the possible hazard. Dogs that have bitten people must be quarantined for at least 10 days to check if rabies develop. To avoid encounter with wild animals, keep your dog on a leash and stay alert of your surroundings. There have been isolated and poorly reported cases of both dogs and humans surviving rabies. However, early post-bite administration of anti-rabies serum can halt the development from an infected bite to the beginning of the symptoms. Vaccination is a critical component of rabies prevention, and contemporary vaccination for dogs, cats, horses, and ferrets are exceedingly safe and effective. If an unvaccinated dog is at risk of rabies but has not been exposed to humans, the dog should be vaccinated and put in rigorous confinement for many months. If there is a substantial risk of exposure, the safest option is to euthanize the animal, or you can say kill the animal. If the exposed dog has previously been vaccinated, a booster vaccine is recommended, followed by at least 30 days of quarantine in accordance with local public health standards and close observation. There is no cure for rabies in dogs, and if it is suspected, the dog must be quarantined and restrained from escaping or hurting someone. Now, what are some safety measures one can adopt if he or she is bitten by an infected dog? If you encounter a rabies animal, contact your local health department or animal control. Keep your distance, warn others, and alert authorities. If your dog has contact with potentially rabies animal, call your vet for an examination and treatment. They can provide a booster to your dog's rabies vaccination and clean the wounds to prevent infection. File a report with your local health department to locate and remove the animal. Wear disposable gloves when touching or cleaning the wound. If you think a rabies animal has bitten you, call your doctor and wash the bite thoroughly. If necessary, receive post-exposure treatment to prevent the spread of rabies virus. Quick action is crucial to protect yourself from rabies. So that was all about canine rabies. Thanks for watching the video.